What is Cytotron? Cytotron is a machine that has been invented in India which uses electromagnetic principles, or what we call the rotational field quantum principle, in which the technology involves in reversing the process of degeneration of the knee joint in order to actually reverse the polarity of the cells in the knee, and therefore by doing this there is regeneration of cartilage, synovial fluid and improved bone density. There has been a lot of evidence on cytotron in the last few years, and almost about 2,000 people around the world have undergone this treatment. Cytotron is an invention that will change the lives of many people, and therefore we hope that it will actually bring joy to the faces of many around the world, and in Malaysia of course. Before a patient actually makes a decision to undergo cytotron treatment, we ask them to come in for a free consultation, and after examining the patient and identifying whether the patient has a form of osteoarthritis, we do advise these patients to actually undergo MRI or magnetic resonance imaging of the affected knee, and thereby to identify whether the case of osteoarthritis is done for, and therefore we make these patients actually undergo this MRI treatment. And once we have the MRI pictures here, we like to discuss with the patients their condition, their state of osteoarthritis and grade of course, and thereby determining whether they are an ideal candidate to undergo cytotron therapy. Now, let me explain something about the cytotron machinery as well as the MRI of the knee in order to make a decision whether the patient has actually have to undergo the cytotron treatment. Now what you see here is an MRI. Of course this is an MRI of the knee joint, and as we can see here, this is an MRI of the right knee joint, and we have special measurements which are done in the cytotron MRI in order to make our decisions whether the cartilage or the synovial fluid has been depleted. What we see here is just the bone, or what we call the femur, which is on top here, which is also called in simple terms the thigh bone. And we have another bone here called the tibia, which is also called in simple terms the shin bone. In between the tibia and the femur, we have the cartilage, which is shown here very clearly as a white shadow, and the synovial fluid which goes along with the cartilage in between the joint. Now we determine the thickness of the cartilage by seeing a certain figure here, which is actually the distance between both these bones. That will actually tell us how thick or how thin the cartilage is actually determined. And as you can see here, D3 or what we call 3D3 actually shows the thickness of the cartilage, which is just nothing but 0.12 cm, thereby showing the cartilage is very thin and has definitely undergone a lot of degeneration over the last few years. This shows the bone density of the femur and the bone density of the tibia. Now we also like to look at a cross-sectional study of the bone and the cartilage, thereby determining the distance between the skin and the bone, and skin and the bone on this side. So it's always on a cross-sectional study, and basically it is in the region of the patellofemoral region. What we do is we take the distances from all these positions here and the thickness of the cartilage, and we incorporate it into the computer, and the computer deciphers the problems which are going on here, including the calculations, and thereby feeding information into the cytotron, and the cytotron takes over and treats the patient. Right, so once we finish the MRI, we again counsel the patients on how to undergo the treatment of cytotron, and once the patient is confident, we advise the patient on dietary requirements, we advise the patient on different techniques of exercise, and of course supplementation during the period of cytotron. And as we know, the cytotron treatment is for 21 days, half an hour every day, and after that to come back for another interview with us, and hopefully we can do an MRI maybe 3 months after the last treatment on the 21st day of the cytotron protocol. Thank you.